All right, welcome back to the Lightning Step Couch. We are in Denver, Colorado at the NAATP Conference 2024. Sitting with me right now is my guest, Ellen Frenkel. She is the Chief Commercial Officer with Spark Biomedical. Ellen, thank you so much for joining us today.
To be here.
Can you tell me a little bit about yourself
Okay.
and Spark Biomedical?
Sure. So I just joined the company recently in the last few months. Have a long history in selling medical technology, and what really drew me to Spark is the excellent work they're doing scientifically to help people with a non-pharmaceutical agent that can help them through opioid use disorder.
Sure.
So it was really the science that drew me here.
Yeah. So what's your background?
My background is in sales and marketing for medical technology companies, everything from selling pacemakers, defibrillators, implantable neurostimulators that help people with a variety of conditions. So that's my background.
And what's the importance of products like you're offering? Where do they fall into the need, or what's the benefit of them?
Well, the beauty of it is we will meet patients in recovery wherever they are. So what we do is produce a device that's non-invasive neurostimulation. We stimulate two nerves in the neural network, and that network is where the brain endogenously produces its own opioids. And that's what's diminished with opioid use disorder. So the neurostimulation is tailored to the patient. They control it through a neurostimulator. It's completely non-invasive. They can't overstimulate themselves. So it's very beneficial for them. And again, wherever they are in the recovery path, if they're using medication, this can be adjunctive to it. If they want to go full abstinence, this will get them there. And in our clinical data, it was very, very significant reduction of symptoms within 30 to 60 minutes of wearing the stimulator.
Can you expand a little bit on how it can either stand alone as a replacement or work in conjunction? What are some facilities doing today that you're trying to give them another option to do?
Sure. So facilities have a variety of regimens that they employ for their patients. And the unique thing about this is it can be tailored wherever they are deploying MAT and using medications. Again, we will work in conjunction with that. We studied it in our clinical trial for FDA clearance that they could use it in addition to medication. So we are finding the full complement of people who are using it just as an adjunctive therapy. And once those patients are feeling better, they're more receptive to the other behavioral health treatments that the patients will benefit from. Their full abstinent programs are seeing patients, stay on the therapy till they're feeling well, and again, they can live a abstinent-based life without with the neurostimulator too. And most people are on the therapy between 12 to 14 days, sometimes longer, with other substances like fentanyl that are more significantly impacting them. So again, we try to talk about that very specific neurostimulation for the patient.
Okay. So you offer a technology, and facilities use a number of technologies within their facility themselves, like an EHR, like Lightning Step, and a number of other things. How do you work with those other technologies in the facility?
It's completely complementary. So there's no adverse events using this in complementary fashion with other technologies. If the patient themselves has a pacemaker or cochlear implant, that's the only way that they wouldn't be eligible to use to help their patients.
Yeah, I think that's important. I think they're always looking for, ways to improve the care that they provide, alternatives to some traditional regimens, like you say. So, you know, people use Suboxone and Methadone, which have their benefits, but there are some folks that don't want to use that.
Right.
And so is that what you're speaking about, that you can work in conjunction, or you can replace that altogether if that's the goal?
Yes, if that's the goal, we can replace it altogether. Again, we do not dictate a protocol. We will fit into that protocol that is benefiting the patient the most, or what the clinic believes in the most. So very flexible. There's a lot of agility to how it can be deployed, which is what makes it a unique and complementary therapy.
Okay. And you're using it, you're in facilities now, I'm guessing, okay. And have you seen benefits? Can you talk about some of the benefits that you've already seen with some of your clients?
Yeah, so we're in facilities. We want to be in more. Certainly, we're taking the opportunity to be at events like this to get the word out. Spark's been around for 5 years, but still quite unknown to many communities. But where we're seeing it do really well, inpatient facilities, where again they can work with this patient on a day in and day out basis. Also in an outpatient facility, we are selling directly to patients with a physician prescription as well. So if a patient's in recovery in their home and doing it independently, like many people do, this is an adjunctive tool for them to use in their home as well.
That's super neat.
Yeah.
Yeah, I love that. So, like I said, our guests and our listeners are people, they're clinicians, they're facility owners. Is there a message that you want to get out? Anything that I haven't covered in this that you really want to make sure that our listeners know about Spark, about your products?
Sure. Well, appreciate the opportunity to give one last shout out about Spark, but we again want to be out on the leading edge of helping take care of this patient population. They solely are in need of more therapeutic options. Spark is just one of many at their fingertips, but what we're doing is very unique and it's very well founded in the science. So our two of our founders are neuroscientists by training, and we're not finished. We're doing a lot of clinical work right now to improve the device, improve the indications so we can treat more issues that patients have. So we are just here to help and want to be a partner in the care of these patients.
We love that. And we're always looking for partners, anything that can improve care. So, a true behavioral health innovator. I think that's really, the point of a lot of these talks are to highlight some innovators in the space. And I think Spark Biomedical is definitely one of them. I want to thank my guest one more time, Ellen Frenkel, the Chief Commercial Officer with Spark Biomedical. Ellen, thank you so
Yeah,
much for your
thank you.
time today.
Appreciate it.
Yeah.
All right, take care.
That's